certain I've lived a life that's full.
Hello everybody. Hello all my supporters, my viewers, everybody who is watching my show, everybody who has been around to support my show, everybody who has been around to help me with the show that I have, the show to educate our seniors, the show to educate our population. Again, we're here. This show is for the seniors mainly. We educate people. We go around and not just on the social media, but we go everywhere to educate as many people as we could about how to take care of the seniors. My name is Jean Bastilla and I'm with AWC Home Care. AWC Home Care is a home care in Atlanta, Georgia that is providing quality care to our seniors. So if you are aware of somebody who is in need of some home care services, please call us. Our number is 678-696-9905. Or you can visit our website at www.awchomecare.com. Today we're going to talk about a very, very important topic. If you sit there and follow us, if you don't go anywhere, we're going to talk about aspiration pneumonia. We're going to come up with some information that will be very critical for you to take care of your loved one at home and to make sure they don't get sick, they don't end up in the hospital. With aspiration pneumonia, we're going to look at the etiology, we're going to look at treatment and management as well. So again, I want to say thank you to you for being here. Thank you to you for turning on to our channel. We'll be talking about aspiration pneumonia. Well, what is aspiration pneumonia? Let's get to it. Aspiration pneumonia is a condition in which you have gastric content or pharyngeal content going into the base of your lungs. That's pretty much what it is. That's what pneumonia, aspiration pneumonia is. Now, when we talk about our seniors, aspiration pneumonia is an extremely important topic. That doesn't mean that aspiration pneumonia cannot affect other people, but you know, for the seniors, it is even a bigger problem because of the issues, because of the comorbidities that our seniors usually have. So this is why I think it is very important that we talk about aspiration pneumonia and look at different ways to manage aspiration pneumonia. Well, we said when people are eating, usually when you eat, the food goes through the correct pipe, which means the food goes to the stomach. But unfortunately, for some people who have neurological issues, who have multiple sclerosis, or somebody who drink too much, or any issues that impaired your mental or your mechanic of swallowing, can cause this food to not go into your stomach, but to go into your lungs. Imagine having some pieces of chicken in your lungs. Imagine drinking that Kool-Aid or juice and it goes into your lungs. This can cause you to be very sick of you having ketchups in your lungs. Can you imagine that? You having mashed potatoes inside your lungs? This is very bad. So here's what we're going to do for our seniors, for our people who are at very high risk. And statistically, it shows our seniors are very, very high risk for aspiration, especially those who are living in nursing homes. So what do? There's a few things we can do to help that, right? We can help preventing the aspiration by making sure those people, we always keep them at a 30-degree angle when we're feeding them. This is extremely important. We must make sure our seniors, when we are feeding them, we don't lay them flat in the bed. So you want to make sure you sit them up You want to make sure when you sit them up, you take your time when you're feeding them, because one of the problem we have when we are feeding our seniors, sometimes we're in a rush. We're in a rush. We want to go and get it done. No, please take your time. Give them a small bite at a time. Don't give them too much. Give them a small bite at a time, and then take your time. Allow them to swallow it. Don't double the bite when you're not sure that they swallowed it fully. The other thing you want to do after you feed them, you want to make sure you keep them at a sitting position for at least 1 to 2 hours before you lay them on the bed. Because laying them in the bed will cause it makes it very easy for the stomach content to go up and cause aspiration. Also, for those who are on a tube feeding, so if you work in a hospital, if you're a nurse, you work in a hospital, one of the things you want to do, you want to always put that tube feeding on hold when you're trying to turn that patient. Again, when we turn our patients, usually we turn them. First thing we do is lay the head of the bed and we try to pull them up. So you want to make sure you always put the tube feeding on hold, because if you don't do that, you're going to lay them flat, and that food, that tube feeding they are receiving will or can go up and go to their lungs and cause aspiration. The other thing you want to do, you want to make sure that the mouth is clean. You do very good oral care, because you may feed somebody, a senior, and you think, oh, they look good, they are fine, there's no problem. But then what happened is later on, that's when you realize that you didn't do very good oral care. They aspirate the residual of food that were pocketed on the cheek. So you want to make sure you clean their mouth. You want to make sure you check them out to make sure the mouth is clean. There is nothing left in there, because if not, it easily causes them to be aspirated. Now, if you're watching this video, if you have a family member and you think they may be at risk for aspiration, what I want you to do, I want you to seek for professional help. Again, you could always use the different techniques that I just listed. However, you want to look for a speech therapist. Speech therapists, usually they help. That's what they study, that's their specialty. So they can go there and help you, give you different, better techniques as far as taking care of that person. And also they can help determine what type of food. Because sometimes we aspirate because of the food. So it may be that they need a more modified diet, like a mechanical soft diet, or a thickened liquid. Because a lot of the time, the thinner the liquid, the easier for somebody to aspirate. So you want to make sure you get professional help. You want to make sure you get a speech therapist who could come in and check the swallowing, make sure, hey, this is what it is, and they can tell you exactly what type of diet they think that person should be taking. Because again, people, when I talk about aspiration pneumonia, for those of you who don't know, there's a very high, this is like a nursing home, this is one of the #1 causes of death. So you want to make sure, because sometimes for that simple aspiration, something that could have prevented cause somebody to die, or cause them to not be at home or be at the nursing home where they consider as home. They end up in the hospital for several days being treated with IV antibiotics. So my job is to try my very best in the community to try to prevent those patients from going into the nursing home, because remember, I'm fighting for people to stay at home, which is what I believe in, but also for people to not go in the hospital when they could have stayed at home. So this is the purpose of every video that I have been putting out there. Again, we will continue to do this. And the purpose, really, the full purpose of what I'm doing is really to educate people about taking care of seniors. Because if I say my goal is to keep as many seniors in their home, but again, in their home safely. So if I want to keep them at home safely, I also need to bring education for people, for family members, for healthcare professionals, to be able to take care of those older people at home. Because if we don't take good care of them, they can end up dying at home. So again, when I say we want to keep as many seniors in their home, when I say this is what I believe, I don't believe we should keep them at home if we cannot keep them safe. I believe that we must keep them at home, but we must keep them at home safely. And this is why I have gotten into taking the journey of educating people, of looking around for all those topics, for all those issues like pressure ulcers, aspiration, falls, things that happen in our seniors, things that prevent them from staying at home. I've been looking into those issues and go around and teach people. Again, I don't do this only in social media, but I do a lot of free education. I go to many of the assisted living. I go to many of the nursing homes, senior communities, retirement places. Anywhere there's seniors, I go and talk about seniors and talk about what they did for us. Think about why we should focus on taking care of them today. Think about why we should make sure they maintain the integrity in our home, because that's where they belong. And again, as I always say, this is where they feel love. Be at home. I believe in it. And again, I'll continue to provide those education. If you are watching, I want you to please share this video, share it with other people. I want you to encourage other people to spread the message of why we should be taking care of our parents, why we should be taking care of the people who are old now, the people who can't take care of themselves, why they need our help, why we need to focus on them. Don't treat them like because they're old that they don't have a place in our society. This society belongs to them. I believe in this. And again, if you know of anybody who is in need of some home care, if you know anybody who needs somebody to assist them, I will personally go to their home. I'll do a free evaluation. It does not cost them anything. I'm just gonna go there just to make sure they are safe at home, just to make sure they can continue to stay at home. Because many people out there do not know, they have no clue that somebody can go to their home and help them with some light housekeeping. And by the way, we just started a new program. This is a new program. It's going pretty well. What we do, we try to help people with very, very light housekeeping for just like 1 to 2 hours. So we've been going in many of the senior communities and providing education, talk to people. So what we do, we send somebody on a weekly basis just to help them with light housekeeping. Because a lot of people who end up falling, end up having injuries, many of them, they have it just because that one day they try to mop their floor. Something that they were not able to do. So what we do, we create a new program where we charge them very minimum just to send somebody there to just do light housekeeping. And we're talking about pure prevention. Those are people who can still walk around. They still do their everything. They may be using a walker or a cane, but really they can do everything on their own. But we send somebody there. I mean, still a CNA. We send them there just to help them with light housekeeping. Just those, lifting this furniture there, cleaning under the furniture. We send somebody there to help them. With that, we try to keep them safe so they don't end up falling. Because that's what happened. A lot of the time we wait until the problem arises. That's when we try to fix it. Well, it's better for me to go there and try to assist them before they get injured. And my job is to educate them, to tell them why I think it is important, to give them example, rationale as far as why I think that would be helpful to them. Because again, those people are people, they're okay. They are doing well in the community. They are doing well at home and everything. But what you don't want is, if they're doing well right now, you want them to continue to do well at home. You want them to continue to be at home because you do know truly you would never want to give up your home. You would never want to leave where you stay and go somewhere else. And a lot of the time, unfortunately, you end up going to the nursing home, you still fall. So it's better for me to try my very best by preventing those injuries. by preventing those conditions that will make them go to the hospital. By preventing, same today we talk about aspiration pneumonia. But again, if you look at it, if you end up with aspiration pneumonia at home, you were not educated, you didn't know how to take care of a loved one at home. A lot of the time, we don't have to provide the service to you. I just go there and sit with you. It doesn't cost you anything. I tell you, hey, if you think when you're feeding them, this is how you feed them. This is what you should do. I advise you on things you should do, because when you have pneumonia, sometimes being an elderly person, you have a lot of other comorbidities. So you end up in the hospital, and sometimes you don't make it back home. You end up in a rehab center. You go to the rehab center, something happens that, hey, you know what, actually, we can't rehabilitate you within those few weeks. So you're gonna have to be transferred to the nursing home part. This is what we don't want. So to prevent that, we need to do what I'm doing. We need to do our very best to educate our community, to educate them about prevention. And again, prevention in general. But again, our focus, as you guys know, I love the seniors. I have a very big passion for them. So I happen to focus, even though a lot of my education, if you go on my YouTube channel, many of them, they kind of geared toward everybody, adults and children as well. But I focus on seniors because I love those people. But if you do prevention, this is the very, very best that you can do. Guys, I want to say thank you to every one of you who was watching this video. I want to say thank you to you who will be watching it. Please continue to share it. Continue to follow us on YouTube, Twitter, obviously on Facebook, Instagram. Continue to help us with this message that we're spreading. We have a lot of more things coming up. We have actually a new rubric that's called Eat Donuts and Drink Coffee with AWC Home Care. This is a new rubric, so we'll be going to different facilities. This is just a way to encourage people in the community to come by to learn about prevention, to learn about seniors. So again, thank you for watching. If you know anybody who needs help, our number is 678-696-9905. Again, we are a licensed home care agency in Atlanta, Georgia. You can visit our website at AWC Home Care. Again, thank you for watching, and you all have a great and excellent night. I love you all.